So this is a main point question, and in this question the author is saying many patients are hesitant to seek second opinions when making decisions about their health, even when considering major medical procedures. This hesitation is sometimes based on a lack of familiarity with a relatively new physician, but even where a strong relationship has been developed between doctor and patient, the person being treated often perceives the interest in a second opinion as an affront to the doctor who has provided the first opinion. All right. So the argument till now is talking about the hesitance of patients, many patients, the hesitance to seek second opinions when making decisions about their health. Okay. And then these lines further are giving us the explanation of, why that hesitation. So these are the reasons for hesitation. Okay. All right. Now let's read ahead. This tendency, which tendency? Hesitation. This tendency is rather unfortunate. All right. So this is where we are basically getting the author's opinion, right? This is the first time in the argument that author has provided his opinion, and this is what is important for us, because where an author gives his opinion is the important part of any passage, and all the authors write the passage to prove their point, okay, and their opinion about the topic is the main point of the passages, right? And in this question we need to find the main point. All right, so we need to figure out from these statements what the main point is. Okay, so let's read ahead closely. This tendency is rather unfortunate given the potential benefits. Okay, so according to the author, there are potential benefits, and what these benefits are described ahead: of further confirmation that a particular part represents the proper course, or of contrary perspectives which can be considered for more fully informed decisions. Okay. So how this passage, the small passage, is structured is, the author says many patients are hesitant to seek second opinions. Then the author gives his reasons for why the patients are hesitant. Okay. And then the author says this tendency is unfortunate. Okay. And then he gives his own reason for why this tendency is unfortunate. Tendency is unfortunate means author's opinion is that it should not be done. Right? What should not be done? The hesitation in seeking second opinion should not be done in author's opinion. All right? So what is the main point that we can figure out from this discussion? Okay, so for these kind of questions, even before looking at the option, okay, if we have understood the passage properly, we should be able to tell what is the main point of the passage without even looking at the options. So what is the main point of the passage here? The main point is the author's opinion, and what is his opinion? That it should not be done, right? Hesitation to seek second opinion is unfortunate given the potential benefits. All right. So this is what we have to look for in the options, and let's just go through the options one by one and see which one is correct and which ones are incorrect. So A says patients should seek second opinions only in cases of questionable intent on part of the physician. Does the author say that only in these kind of cases the second opinion should be sought? No, right? B says some doctors consider the request for a second opinion offensive. So this is, a problem that patients think of, right? It is given in the passage that they may find the request for a second opinion offensive. That is true. So this would be an inference, right? This would not be the main point. So this is ticked off. C says doctors who tell patients not to seek second opinions are attempting to avoid competition with other physicians. Okay, again, not the main point. We are looking for a clear main point here, that patients should not be hesitant. D says, many patients are hesitant to seek second opinions when making decisions about their health. Okay, so this is a reiteration of the premise, right? The first sentence of the passage told us exactly the same thing, that patients are hesitant to seek second opinions when making decisions about their health. So this is just the premise from this passage, copy pasted into the option, obviously not the main point. Okay, all right. Look at E. When considering major medical procedures, patients should not hesitate to seek a second opinion. All right, clearly the main point, just like we discussed. So the correct option for this question is option E.